Dr. Mike Greiwe, and today we're going to be talking about shoulder arthritis and shoulder replacements. So shoulder arthritis can be a very debilitating problem for a lot of patients. Arthritis of the shoulder really limits people in what they can do in overhead activities. It also limits them in activities of daily living, just like things like getting dressed in the morning or taking a shower can be very difficult for patients with arthritis because they can't move their shoulder very well. One of the hallmark features is limited motion with shoulder arthritis, so it's really hard to move the shoulder. And most of the time I treat patients with non-surgical management for this, including cortisone and physical therapy, but occasionally patients require shoulder replacements, and that's what I wanted to talk about today. So this is an actual shoulder replacement, and in order to do the procedure, we have a rotator cuff which comes right across the front part of the shoulder here, and we go through that rotator cuff and we expose the ball and socket. Typically patients have lost their cartilage here in this area, the ball, and what we do is we remove the ball and then we place a stem down into the bone, and the stem looks like this. So you can see that stem right there. This goes into the bone, and then we expose the socket, and the socket looks like this. It's typically worn, the cartilage is gone. We'll place a plastic socket in that area, and then following that we put a ball back on the shoulder, just like that. And then we can attach the ball and socket by repairing the rotator cuff back again. So that's how we perform a shoulder replacement. Typically following a shoulder replacement, patients will stay in the hospital for 1 to 2 days. They'll then come back to the office on day 7 or 8 and we'll remove the stitches. Most patients feel that their pain is diminished relatively by about 2 weeks, although by 6 weeks some patients still have some discomfort. We work on range of motion with physical therapy following that office visit at day 8, and we'll work on range of motion to about 6 weeks. By that point in time, most patients have most of their range of motion back, and we'll start to strengthen the shoulder. And by about 3 months, patients are really feeling good with the shoulder and have most of their strength back and a good bit of their range of motion back. Hi, I'm Dr. Mike Greiwe. I'm a shoulder, elbow, and sports medicine specialist at Commonwealth Orthopedic Centers.